First, the Republican replacement for Obamacare cleared a key hurdle before dawn. The House Ways and Means Committee approved an important provision at around 4:30 Eastern time. And the Energy and Commerce Committee, look at this, still debating the bill. Here is actually a live picture of that session.
Democratic Party delays kept the members working all night, but the health care bill also faces growing opposition from hospital groups, the American Medical Association, and other powerful advocates. Chip Reid's on Capitol Hill outside the room where the debate continues. Chip, good morning.
Good morning. That all-night session is going on in the room right behind me. So far, they've been going at it for just under 24 hours, and Democrats say they're just getting started.
We've gone 12 hours on the First Amendment. No, we've got at least 100 to go, maybe more, so buckle in.
Democrats spent all day and night attempting to delay the overhaul of Obamacare by proposing a series of amendments to the bill.
My amendment would change the title to the Republican Pay More for Less Act.
And insisting the 123-page legislation be read out loud.
Yes, Mr. Chairman, that was my objection.
All right. Then the clerk will read the bill. Members need to know this will take a couple of hours.
After hours of gridlock, Republican frustration became clear.
If we're really serious about fighting for the American people, then let's be serious about the amendments and quit wasting everybody's time.
Will the gentleman yield?
No, not right now. I'm kind of on a roll.
But before worrying about Democratic support, the GOP needs to convince some in their own party the new plan will work.
This is an all hands on deck because you know what? We all ran on repealing and replacing Obamacare.
House Speaker Paul Ryan tried to persuade conservative leaders the plan presented is everything Republican constituents want.
It repeals Obamacare's spending, Medicaid expansion, and the Obamacare subsidies.
But yesterday, an influential group of hospitals and health care providers sent a letter to Congress expressing significant concerns that the plan's Medicaid restructuring will result in the loss of coverage for current enrollees. The AARP says the bill would dramatically increase health care costs for Americans aged 50 to 64 in the individual market.
Everyone has some concerns.
Members of the deeply conservative Freedom Caucus also remain unconvinced.
The product we got to get right, and we don't have the product right in this thing.
Democrats say this bill shouldn't even be considered until the Congressional Budget Office says how much it is going to cost. Democrats have over 100 amendments, and one hospital lobbyist who's been monitoring the entire hearing told me that if the Democrats continue at the current pace of amendment after amendment after amendment, it could take more than 19 days to finish.
Chip, thanks for that update.